Okay, hi everyone. Welcome to our Backfighter Knowledge Exchange conference call, What About Produce Washes? This is Mary Saucier-Choate, Manager of Outreach and Stakeholder Engagement at the Partnership for Food Safety Education. I'll also be the moderator of our call today. I want to thank you all for joining us for our Knowledge Exchange topic, What About Produce Washes? Dr. Whitaker is the Chief Science and Technology Officer for the Produce Marketing Association. In this role, Dr. Whitaker has responsibility for food safety and security, environmental sustainability, and technical innovations for the produce supply chain from field to fork. Among other topics, Dr. Whitaker is an expert in commercial produce wash water management for use in agricultural production. Before we begin a brief interview with Dr. Whitaker, I'd like to review the current consumer advice about washing of fresh vegetables and fruits. The U.S. Food and Drug Administration recommends the following for consumer food safety. Wash all produce thoroughly under running water before preparing and or eating, including produce grown at home or bought from a grocery store or farmer's market. Washing fruits and vegetables with soap, detergent, or commercial produce wash is not recommended. Even if you do not plan to eat the skin, it is still important to wash produce first so dirt and bacteria are not transferred from the surface when peeling or cutting produce. Scrub firm produce such as melons and cucumbers with a clean produce brush. After washing, dry produce with a clean cloth or paper towel to further reduce bacteria that may be present on the surface. Tested visual tools for promoting safe handling of fresh produce can be found at the Partnership for Food Safety Education's Produce Pro materials found at fightback.org. So now to Dr. Whitaker. Dr. Whitaker, I think all of us would be interested in knowing, before lettuce and other salad greens end up at the grocery store, what kind of antimicrobial process wash is used on these products, if any?
Yeah, thank you, Mary. Commercial wash systems use combinations of spray bars and rapid water currents and even air bubbles to loosen dirt. Nearly all fresh produce that is washed prior to packing is treated with a water sanitizer like sodium hypochlorite or chlorine, perhaps chlorine dioxide or other common wash water disinfectants like peroxyacetic acid. These different products all behave a bit differently, but they're all there to do the same thing: kill any microorganisms that wash off the surface of the produce and into the water so that they cannot reattach to the raw products as they move through the wash system and spread to the whole batch that's being washed. It's important to note what I didn't say. I didn't say kill the microorganisms that live on the surface of the produce. It is a common misconception that using wash water treated with a disinfectant will sanitize the surface of the produce. That's simply not the case. Under the best of conditions, a commercial produce wash system might reduce the microbial population that naturally resides on the surface of the product by 1 to 2 logs, or about 10 to 100-fold. For example, a batch of spinach with 1 million microorganisms per centimeter might come out of a well-operated wash system with 10,000 microorganisms. Now that is not really a bad thing. Most of these microorganisms naturally occur in the produce environment and do not cause disease in humans. And in fact, they're part of the natural environment and may help the plant ward off plant pathogens that can kill the plants. Some help in the natural decay of plant materials to improve soil health, and still others are helpful for human digestion of nutrients. It is only when human pathogens like Salmonella or E. coli 0157H7 enter the production environment and transfer onto the surface of the fruit or vegetable that we need to be concerned. That is why growers have good agricultural practices, or GAP programs that we've all heard about. They have these in place, and why Congress passed the Food Safety Modernization Act, or FSMA, and FDA developed the regulations under the produce rule from FSMA to reduce the risk of contamination with human pathogens during growth, harvest, cooling, and packing of fresh produce. Another line of defense is a properly designed and operated commercial wash process where the wash water sanitizer kills any microorganisms, including human pathogens, if they are present, that wash off into the water. The science for proper control of commercial wash systems is advancing rapidly. For commercial manufacturers, the Preventive Control Rule mandates that operators validate their wash conditions are being effective in controlling microbial populations in wash or cooling water, and that they verify these conditions are followed every time the wash system operates.
Thank you so much for that overview. Really interesting. So today we really wanted to give a short overview of produce washes, or so-called veggie washes, that consumers can buy at retail stores. Would you give us an overview of the efficacy of these consumer produce washes? I will also note, as I said earlier, that the FDA does not recommend use of these washes by consumers at home.
Yeah, I mean, that's a good point, Mary. I mean, the FDA does not recommend the use of these products, but it's important to understand why. First, the nature of produce and the interaction between microorganisms and plant surfaces. Bacteria produce polysaccharides and biofilms so that they can attach themselves, almost like a glue, to the surface of the fresh fruit or vegetable. Microscopic indentations in the fruit or vegetable surface also protect against wash water and disinfectants. Fruits and leaves and roots are biological materials, and as such, they have electrical charges on their surface or their skin, the epidermis, that covers them. Sometimes these electrical charges actually repel the water so that the sanitizer never gets to the surface where the bacteria might be. Pre-wash products that come in a bag, like bag salad, apple slices, or carrot pieces, have already been washed prior to packing in commercial systems and then packaged in specific protective packaging and stored cold. Removing previously washed products from these packages to wash them again may actually increase the risk that they could become contaminated by microorganisms that might be, on the preparer's hands or on knives or cutting boards that have been used to prepare other foods or simply on your kitchen counter. So it's with this backdrop that you can understand FDA's long-held position and look at some of these. So it's with this backdrop that you can understand FDA's long-held position and look at some of these retail veggie washes.
Some brands of consumer produce wash have actually done comparative studies. Would you talk about these and interpret their results for us?
Sure. A number of studies have indeed been done by some of the most well-respected food scientists and microbiologists in the United States, but it's really hard to compare them because the experimental designs, pathogen strains selected, and the methods that they've used are pretty inconsistent. However, a few things did stand out as I reviewed the literature on this as we prepared. The ability of a sanitizer to kill harmful pathogens is often dependent on the genetics of the pathogen itself. For example, a sanitizer may be more effective against the Listeria and less so against the Salmonella. Fishburne et al. Saw that this in his 2012 paper, where using his protocols, chlorine bleach was much more effective against Listeria than any other of the sanitizers tested. A veggie wash product, electrolyzed water, ozone, or just plain running water. It's also likely that comparative studies within pathogen strains would show variability to susceptibility of specific sanitizers as well. For instance, one might find or expect to find that some LM isolates are more or less sensitive to certain sanitizers, and the same would be true for Salmonella and E. coli. Different surfaces also represent different challenges. Therefore, preparing a single formulation of a sanitizer in a consumer wash product becomes a very daunting task. A sanitizer that might be very effective on a lettuce leaf perhaps would not be as effective on a cantaloupe leaf. Other examples of studies I reviewed all suffer from the same problem. They rely on inoculation studies where a number of fruits and vegetables are simply inoculated with a prepared mixture of selected human pathogens. They permitted them to dry for 60 to 90 minutes, and then they wash them with one of the sanitizers to evaluate how effective that sanitizer is in killing the pathogen. It sounds fairly straightforward. But the problem is that the physiological state of lab-prepared bacteria would be expected to be vastly different from the one that might have resided on the surface of a fruit in the field that is exposed to the sun and the wind and survived the initial wash in a commercial packing house. Then went cooling in 1 to 2 weeks in transport and in storage at retail and then a consumer's home. There's a lot of history there. These naturally present pathogen contaminants have largely gone into a dormant state by that time, where they shut down much of their metabolism to preserve themselves from the environmental insult that they are undergoing, and they protect themselves with biofilms. Comparing the effective kill of sanitizer treatments on pathogens that have been placed on a surface in laboratories with those transferred by a natural contamination event seems really doubtful to me. And then lastly, in a couple of the studies I reviewed, washing vigorously with running water containing no sanitizer at all was sometimes as effective as washing with water that contained a sanitizer. Often the efficacy was improved if the water or water plus a sanitizer were supplemented with rubbing or scrubbing of the surface. This action would actually be expected to dislodge pathogens that were adhered to the surface where the sanitizer couldn't kill them, and now they're dislodged and the sanitizer plus running water can carry them away. However, in no paper that I reviewed did I see any treatment where pathogens were totally eliminated from fruits or vegetables they were inoculated onto. To complete this question, the conundrum developers of consumer fruit or veggie sanitizers have is to find a chemical or physical treatment that is effective in eliminating pathogens, can be accomplished without complicated equipment, is easy and safe for consumers to use. For example, commercial wash water sanitizers like chlorine and ozone can be very effective when administered and controlled by professionals, but consumers without proper training or monitoring equipment might expect to get off-gassing of free chlorine or ozone, which can be harmful if it's breathed in.
Wow, so interesting. Let's see, in 1997 there was a scientific advisory panel convened by the Environmental Protection Agency. It was called Fresh Fruit and Produce Sanitizing Wash. Can you give your take on the findings of this scientific advisory panel on the question of household fruit and vegetable washes?
Sure. The 1997 EPA advisory panel basically raised the same questions or challenges that I just reviewed. But for background, it's important to know that the EPA has the responsibility for registering antimicrobial pesticide products. And yes, an in-home fruit or vegetable sanitizer would be considered a microbial pesticide. The EPA has well-established methodologies for testing sanitizers on hard food contact surfaces. The problem is they don't really have any scientifically valid methods for testing sanitizers on biological or more porous surfaces. The test method would have to include many of the factors we've already discussed today, like procedures for doing inoculation studies and concentrations of test pathogens to use, which pathogens to use, the temperatures, the numbers of samples and replicates of samples, etc. The list goes on. The treatment needs to be a single activity, like a spray or a soak, which a consumer can easily do and do reliably and safely in their home. EPA has asked for more research on these questions, and we have seen various efforts to begin to define fresh produce sanitizer efficacy. Harris et al. Published a method for testing sanitizers in fresh tomatoes in 2001, but I'm not aware that any single methodology has been defined for all of the reasons we've already discussed today. Development of a universal consumer wash treatment remains an elusive object.
Dr. Whitaker, thank you so much for your input on this topic. In just a minute, we're going to start taking questions. Let's finish up your thoughts on the evidence about whether consumers are actually washing their produce at home properly.
Sure. It seems like everybody, has their own approach. The USDA has asked this question before of consumers about, to what extent do U.S. consumers follow techniques for washing fresh produce that are associated with favorable food safety outcomes. But like I said, everybody's kind of got their own process they use in their home. And I can just tell you that in my own house, if my wife washes produce versus me versus my two daughters, that, the way I've observed it, it's amazingly different. In 2007, Darad and all found that among Puerto Rican home meal preparers, 87% washed their lettuce and 85% washed their tomatoes under running water while preparing a salad. In their direct observation study among 99 U.S. college students in 2004, Anderson et al. Found that 6 did not clean any of the vegetables they used to prepare a salad, 70 rinsed the lettuce, 93 rinsed the tomato, 47 rinsed the carrots, and 55 rinsed the cucumber with water. This study also documented that average washing time ranged from 4.8 to 12.4 seconds, some substantially shorter time than the recommended by Colanzo and Nathengi in 2006, where they demonstrated that washing certain fresh produce under cold running tap water with rubbing and brushing for 60 seconds reduced the surface bacterial contamination. So these findings indicate that washing practice can vary significantly in households for different vegetables, and that these behaviors need to be substantially improved, which is certainly a formidable task.
Thank you so much, Dr. Whitaker. We are thrilled to have a great group of backfighters on the phones. Let's go to some of their questions. And while we're waiting, so I have to switch to the Q&A session. while we're waiting for the questions, we'll ask some of the questions that I sent you, Dr. Whitaker. Did you happen to see that? You might have been too busy, but are you there? Oh, wait, you probably can't hear me. I have to unmute everybody.
I'm sorry, I can't see you. I don't know the questions that you said.
Okay, well, I'll have them, and I can send them to you again, or I'll just ask them to you. They're going to be things like, does vinegar and baking soda work as well? Of course, you've already shown that no, but they might ask for, you said this just now, but one of the questions was, how long should you be doing this?
Right.
If you want to, I can send you the questions ahead of time, the ones that
if you send them to me, I'll certainly glance at them before tomorrow and make sure that I don't have any real problems with them. If I do, I'll let you know beforehand. But these are questions that you guys have made up, or questions that you've already solicited?
People have sent them in. When they register, they could also ask questions ahead of time.
Oh,
so these are
okay.
So I'll send that to you.
I don't have any questions here. Now, again, I've gotten about 7 emails since I started with other meetings today, so I haven't really looked closely. But if you could
put it in I'll put it in. Okay. I'll try to make it obvious that these are the questions you might want to look at. But I mean, you can answer all of them easily. I'm quite sure, and so could I. Actually, but,
well, if I start to stumble, jump in, man.
What did you say?
If I start to stumble, jump in tomorrow, please.
Okay. Now, Dr. Whitaker, one thing that just happened when I switched to Q&A, you were muted. And that is because, I think, did you do the thing about pressing? You put in the dial number, you press the access, you put in the access code, and then you came in as a regular participant. But after you enter the access code, if you would press the star key, you'll be asked for your host PIN, which is 3074. And then when I go to Q&A mode, you won't be muted, which is kind of important because I might not be able to find your name. You know what I mean? I might not be able to find your phone to unmute you if there's hundreds of people on the call. You know what I mean?
Yeah, you know what happened is when I dialed in, I got your voices immediately, and we just said hello and we started. So I didn't get a chance to enter anything. So tomorrow I'll make sure that I'll do that. Yeah, because as soon as I dialed, let me just reduce this and I'll tell you exactly what I did, because I still have the screen up. So I dialed 563-999-2090, and I entered in, when it asked for my access code, it said, enter your access code and press pound, and I did, 735-525-pound. It never asked for me for my host PIN.
Okay.
I automatically got you guys, and you asked if it was me.
Yeah, I think what you need to do is press star. In fact, if you wouldn't mind, we can hang up in a minute and try. I just want to make sure that you do not get, because I'll have to be aware of your phone number, otherwise in hundreds of numbers. I think what you need to do, don't listen to them. Don't press pound. Press star.
Okay.
And then they'll say enter your host PIN, and then you'll do 3074.
All right.
And I can send you all that again. I'll that I think is what threw us into into a tizzy.
Yes.
I mean, just now. This is so good to find it now.
Very clear.
Do you want to try that?
I'll do it right now if you like.
Okay, go ahead. Hang up and then come back, pressing star after the access code. Okay, thank you, Dr. Whitaker. Bye. Okay. So, Shelley, while we're waiting, are you still there, Shelley?
Yes.
Okay. So I timed it, and that was 12 minutes and 45 seconds. I know we wanted to be 11, but isn't that close enough to have 12 minutes and 45 seconds?
I think you should probably try to cut it a little more. I don't know if you can cut anything in your part at the beginning.
I probably could.
Yeah, because you want to try to get to it was pretty good, but people love the Q&A, and you're going to take all the Q&A live, right?
Yes.
Yeah, I think that's good.
Oh, good. Are you there, Dr. Whitaker? Hello? Oh, Dr. Whitaker?
I'm here.
Yay, okay. And it clearly says host. I'm looking at a website so I can do this by web, and that's perfect. So I can easily see you, and I can see, we're in the Q&A now, and you're not muted. I'm going to go to lecture mode. Okay. And I've just unmuted Shelley because she came in as a participant. Right. So you're staying as you can hear me the whole time, so that's fantastic. Yeah, and we can hear you is the most important thing the whole time.
Yeah.
Okay. Well, that sounds
Good.
great. We ran a teeny bit long. What I'll try to do is tighten up my thing. I'm wondering if that last question is. It's kind of interesting. The last question about do consumers wash produce correctly? Because that just puts the whole thing into perspective. It's like people are worried about produce washes, and they're not even doing water correctly. Do you know what I mean? They're not even.
Yeah.
It just sort of puts
I'll be a little smoother tomorrow. Tomorrow. I messed up a couple of times. I just haven't looked at it in a couple of weeks.
No, you did great. Are you kidding? This is
And by the way, unless you want to, you don't have to call me doctor. I mean, I'm fine if you just want to call me Bob, but it's up to you. It's up to you.
Well, I know. Well, I wanted to make sure. I'm glad you mentioned that because I've been thinking about you and writing Dr. Bob because I know that's how you identify yourself on the Produce Marketing Association site, right? Don't you have an Ask Dr. Bob column?
Yeah, that ain't me though. That's them. So it's out.
Okay.
Totally.
Yeah, how do you want?
That name stuck with me years and years ago.
Okay. Do you want? I mean, I can call you Bob, or I can call you Dr. Whitaker for everybody. This is going to be like 265 people at least.
Sure.
I don't know.
Whatever you think serves what we're trying to accomplish here. Sometimes people like to use the doctor because there's an air of somehow knowledge. But I'm fine with Bob. If you want to make it more informal, I'm okay.
All right. Well, I'll talk to Shelley. We'll see.
You just do what you want to do, whatever you're comfortable with.
Yeah. Well, I appreciate that very much. Okay, so I think we're good. I'm so glad we figured out the host part to make sure we don't ever not hear you. So that's the whole point of this whole thing.
Well, that was my fault, though. Your directions are very clear now that I've taken the time to look at them, and so I just was following what the phone says. But your written directions on the appointment for today's meeting are clear. So.
Okay, great. All right, so I'm going to send you the questions. The next thing I'm going to do once we hang up is send you the questions that the folks have already sent in, just so you can see. And I edited them because some people ask the same thing, like different people ask the same question, so I just summarized them. Okay.
Sure.
Well, fantastic.
Let me ask you one question. Tomorrow we start at what time? Just to make sure I have it.
1, but try. I mean, it would be good. Say that again.
So you'd like me on the phone at what time, though, to make sure? 12:45.
Yeah, maybe 5. Yeah, maybe 5 of would be good. 5 would be the latest I'd like you to be on. The thing is, we can't chat. If we chat, everyone can hear us. So
I see.
So do get on it. What do you think, Shelley?
What? Yeah,
now,
everyone. Yeah.
5 minutes is enough to get on.
Oh, to get on 5 minutes in advance?
Yeah, I think we should do more than that.
I mean, one of the problems, and the reason why you might want to tighten the whole script up just a little bit more, it's just like a webinar, right? Nobody gets on until 5 minutes in, and when you're doing a 30-minute thing, they're missing some of the core content. I think getting on 5 minutes in advance is fine. I would advocate calling him Dr. Whitaker because, again, I think Bob's right that this crowd, I think that's important. Also, that's who he is professionally.
Right.
I think it's going to be a great topic. I'm really glad we're.
And I will go through this a couple times tomorrow. Immediately before this webinar, I have blocked out space just to read through it so it doesn't sound stilted. And so I'll be a little smoother tomorrow.
You guys sounded good, I thought, and there's a lot of really good content.
Really good. Okay.
Now, are you going to use that script someplace else?
No. I was thinking about that, though, Dr. Whitaker, if we should use it, Mary, because, we could publish it as a leaderboard conversation or something.
Yeah, you could actually use the full script if you weren't limited.
Yeah.
Oh, the full script, that's right.
We have a website leaderboard, and these types of things as an interview is, a good way to, then it can be linked to. It's great content.
It is great content. That's a great idea. If you don't mind, Dr. Whitaker, we'll use the whole thing. We'll use the longer version on our website.
Yeah. And if you need anything from us on that, just the person that is the content person that I work with is Cindy Neal. And so it's cneal, Neal, at pma.com, and she can get you whatever you need from our side of it if you need any more. And if you're going to use it, let us know that you've published it, because maybe we'll cross-link to it or something for you.
Yeah. Great. Okay.
But I'm fine with it. I mean, look, we put a lot of work in this. We might as well use it, right?
Right.
Yeah. Yeah. Okay. Well, then I'll meet you all here tomorrow at 5 minutes to 1.
Sounds good.
Okay. Thank you. Thanks,
Look
Bob.
forward to it. Thank you. All right. Bye-bye now.
Bye. Okay.